repeated COVID infections raise the risk of major health issues. Regardless of immunization status, the risk of mortality, hospitalization, and serious health complications from COVID-19 increases dramatically with reinfection compared to a first bout with the virus. As the pandemic spreads and the virus evolves into new strains, the number of infections has increased, but it is unclear what the long-term health repercussions of reinfection will be. The U.S. researchers said that their new study, which was published in the journal Nature Medicine on Thursday, November 10, 2022, was the first to examine how reinfection raises the risk of health issues from both long-term and acute cases. According to the study, people who have had COVID more than once are 2 or 3 times more likely to experience a variety of serious health issues than those who have only had it once. The National Healthcare Database of the U.S. Department of Veterans Affairs had 5.8 million anonymous medical records that the researchers examined. The results were derived from data gathered by the U.S. Department of Veterans Affairs, VA, on 443,588 patients with one SARS-CoV-2 infection, 40,947 patients with 2 or more infections, 5.3 million uninfected people between March 1, 2020, and April 6, 2022. Of the group of patients with 2 or more infections, over 93% of patients had a total of 2 infections, 6% had 3, and just under 1% had 4. The majority of study participants were men. According to Ziad Al-Ali, an epidemiologist at Washington University in St. Louis and the study's principal author, people who got reinfected have an increased risk of all sorts of adverse health problems when the researchers examined the health outcomes of the different groups. Dr. Ziad Al-Ali stated that COVID-19 reinfection increases the probability of both acute outcomes and protracted COVID. This was visible in boosted, vaccinated, and unboosted individuals. Those who had repeated infections had a double the risk of dying young and triple the risk of being hospitalized with a disease. They also had increased risks for neurological illnesses, difficulties with the lungs, blood, kidneys, and diabetes, as well as for issues with the bones and muscles, the brain, and the heart. People who had been reinfected had more than 3 times the prevalence of heart and lung issues. Additionally, research implied that the likelihood of these issues could rise with each infection. Continuous reinfections, Al-Ali deemed worrisome, would undoubtedly boost the burden of disease in the population. Even if one had prior infection and was vaccinated, meaning they had double immunity from prior infection plus vaccines, said Al-Ali, they are still susceptible to adverse outcomes upon reinfection. The elevated risks were particularly noticeable in the first month following reinfection but persisted 6 months later, according to the researchers. Al-Ali urged people to maintain vigilance. He encouraged people to use masks in order to protect themselves in advance of a feared COVID increase during the Christmas season. He also urged the government to take stronger measures to halt the spread of COVID. He said, "We had started seeing a lot of patients coming to the clinic with an air of invincibility. They wondered, does getting a reinfection really matter? The answer is yes, it absolutely does. People should be aware that reinfection is consequential and should take precautions ahead of the quickly approaching holiday season with travel and indoor gatherings," he warned. The fact that our current vaccination method does not prevent transmission, he claimed, is the cause of reinfection. Until we develop vaccines that prevent transmission, provide more robust protection, and are variant-proof, I believe reinfections will continue to occur. The study's weaknesses, according to the authors, included the fact that the majority of the veteran participants were elderly white males. The conclusions of the study were deemed worrisome by U.S. scholar Eric Topol when it was published as a preprint in June. Topol noted in a post that new, more contagious Omicron variants emerged after April, when the study's time frame ended, making reinfections far more common. The VA population, according to experts who were not engaged in the study, does not represent the overall community. According to John Moore, a professor of microbiology and immunology at Weill Cornell Medical College in New York, patients at VA medical facilities are normally older, sicker, and frequently male, a population who would typically have more than usual health difficulties. Even after taking into consideration variations in COVID-19 strains like Delta, Omicron, and BA.5, the researchers claimed that cumulative risks and burdens of repeat infection rose with the number of infections. The good news there is that the better people are protected with immunity, likely the risk of developing some of the complications will be lower over time, she said. In other encouraging news, Al-Ali published a preprint study earlier this week that was not peer-reviewed and discovered that persons who took Paxlovid from Pfizer within 5 days of testing positive had a lower probability of developing long-term COVID.
Did you find this video interesting? Please like and subscribe to my channel, and don't forget to click on the bell icon to stay up to date with my latest videos. Do you have any other interesting information to offer? Any question, or any suggestion? Share it with us in the comments below. I'm sure you'll find many more interesting videos to watch on this channel. Thank you. See you next time.